Hi, I'm Dr. Ernest Brown, and I want to introduce you to a good friend of mine. It's very important as a physician to understand that there is a legacy, that from the past we can learn and move forward. And this little treasure has been with me ever since medical school at Howard. I found it by accident, but I frequently flip through the pages, just kind of taking perspective, if you will. An opportunity to kind of reflect where I am as a physician, but also where we've come from and where I hope we can all get to. So this is a pictorial annal of the medicine and pharmacy, and it's by Parke-Davis, and this was produced in 1970s. I'm going to read a specific chapter here, which actually has nothing to do with being a physician, but a very important part of what I do as a physician is relying on my colleagues. And this is actually a fascinating story about the first apothecary in Canada from what they called New France. A young Parisian apothecary, Louis Hébert, answered the call to the New World in 1605. He helped at Mons and Champlain build New France's first settlement, the habitation. At Port Royal, Hébert looked after the health of the pioneers, cultivated native drug plants, and supervised the gardens. At the waterfront, he examined species of drug plants offered by the Micmac Indians. These included Jack in the Pulpit, Boneset, Mullein, and Golden Seal. When the habitation was destroyed by the English in 1613, he returned to Paris, but the lure of Canada brought him back. And in 1617, he came back with his family, and he lived the rest of his life in Quebec. He was known as the Green Thumb, and was considered to be the first farmer in what is now Canada. It's a fascinating story to look at this because it is the roots of pharmacy. And what we fast forward to present time, I'm sure if Louis had actually seen where we are, he would probably be very dismayed. There is a lot of interest in making money and profit off of the illness. Here he self-sacrificed for his people as they were colonizing a new world. Imagine that. It's like exploring an unknown, uncharted place, and you're there to make sure that your fellow inhabitants are healthy. Otherwise, it fails. But where we look at it now, fast forward, pharmacy and pharmaceuticals is all about the capital gains. There are plenty of examples where certain drugs have been used or proposed and then quickly pulled because it didn't form a financial success for a company. Well, that's not what medicine is, and that's not what pharmacy is. And so I would hope by looking back and through these pages, we can actually pause for a moment and truly go back in time and explore what it meant. And that is my purpose as a physician. It is my legacy to carry on. I will be gone and there won't be much left, but I'm hoping through this series we can actually show and maybe inspire a few people. But more importantly, I want to hear your stories. Do you have any family? Do you have genealogy where you can point to maybe a distant relative who was a pharmacist or a doctor or a nurse? I'd love to hear the stories because that is really important for where we look forward in terms of improving the health of our country, the health of our people, and prosperity. As a house call doctor, I'm untethered. But that does mean that I do rely on pharmacies to actually pick up medications for my patients. And it's a relationship that has developed over time that I know I can reach out to my colleagues. And these tend to be the small mom and pop pharmacies who understand what I'm doing. And they'll prepare the medications and have it ready for me so I can run in and run out and then drop it off at the patient's home. That level of connection, I think is extremely important for what I do. And I know I would not be able to do what I do if I didn't have my pharmacy colleagues involved. So you'll see me scooting around town either on my scooter or my bike or in my car, and I'll very likely pop into a pharmacy and pop right back out and hit back on the road. If I had to depend on the healthcare system, I'd be at a loss and I wouldn't be able to do what I do for my patients. So I would certainly say I practice medicine in an old way, but it's the only way I know how to do it.